This lecture is on urinary and reproductive system infections. So, our urine flows from the bladder to the exterior of the body through the urethra. Females have a pretty short and straight urethra. Men, it's longer and curved, passes through the prostate gland, and is also responsible for transporting semen out of the penis. Now, urogenital infections, infections and disorders that may jointly affect the urinary and reproductive system, and we're going to talk about some of those today. And then we have sexually transmitted infections, and these include diverse agents that can be transmitted by sexual contact. That doesn't mean they're always transmitted that way, but they can be. So our urinary microbiome is diverse. It can change depending on age, sex, your general health. Some of the most common types of microbes are lactobacillus and streptococcus, but there's also a whole variety of other microbes that can be associated with our urinary tract. Now, torch refers to microbes that can be actually transmitted to a developing fetus. T for Toxoplasma gondii, O for others, things like HIV, syphilis, etc., rubella, cytomegalovirus, and herpes. So these are all microbes we have to be aware, or viruses that can be transmitted to a developing baby. Now, these are some vocab words to know, guys. So urethritis, inflammation of the urethra; cystitis, inflammation of the bladder; ureteritis, inflammation of the ureter; pyelonephritis. Now, nephrons are found where, guys? In the kidneys. So that's inflammation of the kidneys. Now, when we look at UTIs, guys, we can look at lower and upper types of UTIs. And for the lower, urethritis and cystitis seem to take place, but they can progress to upper UTI infections. Now, please know, guys, that pyelonephritis is the inflammation of one or both kidneys, okay? And that we can see, again, that's way up there. That's not out towards the opening. Now, bacteria certainly cause a lot of UTIs, and UTIs account for about 10 million doctor's visits per year. Okay, and we can have what are known as complicated or uncomplicated infections. Now, one type of uropathogenic infection is caused by E. coli. So please know, guys, that E. coli causes 70 to 95% of uncomplicated UTIs, 70 to 95 uncomplicated, and 50 to 65 of complicated UTIs. So that can actually, again, get all the way up into your kidneys. There's other types of UTI bacteria that cause UTIs, like Proteus, Pseudomonas aeruginosa, and believe it or not, Klebsiella pneumoniae. I mean, we think of the name here, it does cause pneumonia, but it can also cause UTIs as well. Now, gram-positive bacteria can also cause UTIs. Big one on the list is Staphylococcus saprophyticus. Now, this is normally found around the genitalia anyway, so it can certainly get in and cause an infection. And of course, Staphylococcus aureus seems to cause a lot of problems in our bodies. Now, a very interesting microbe out there, guys, is called Leptospira interrogans. So please know Leptospira interrogans causes leptospirosis. This microbe is a gram-negative spirochete, so it's a spiral-shaped bacteria. It can affect or infect 800 plus people worldwide. There's about 48,000 deaths per year. And in the U.S., there's maybe 200 cases that we see of this every year. Some vocab words. Dysuria is pain, discomfort, or a burning sensation during urination. Pyuria is pus, present in urine. And hematuria, guys, is blood in the urine. Now, yeast can also cause UTIs, guys, and we'll talk a little bit more about yeast coming up when I talk about STIs. But please know that the term candiuria stands for yeast in the urine. Candiuria, yeast in the urine. Now, sexually active infections are caused by a wide variety of viruses, parasites, fungi, bacteria, you name it. The World Health Organization estimates presence of ulcerative types of STIs, such as syphilis, increase the risk of HIV transmission by about 10 to 50% in women and 50 to 300% in men. So we'll start out talking about genital herpes. Please know for your test, guys, that the agent that causes the majority, not all, but the majority of genital herpes is herpes simplex 2, or HSV2. Again, this is what causes genital herpes. So it's estimated that 1 in 6 people aged 14 to 49 have HSV2. Unprotected oral sex can transmit, guys, another type of herpes called HSV1 to the genital area. Likewise, oral sex can transmit HSV2 from genitals to the mouth. So we just have to keep that in mind. Even though HSV2 is normally found in genitalia and HSV1 in the mouth, they can be swapped back and forth if you are participating in oral sex. Now, signs and symptoms, if you take a look here, guys, you can see the pustules here, and right below it, right there, guys, you see how reddened that area is. They call this a dewdrop on a rose petal lesion. I don't think I'd want that rose petal or dewdrop, but that's what it actually looks like. The treatment would be acyclovir, so please know that for your final. Acyclovir will treat herpes infections. Again, acyclovir will treat herpes infections. HPV, a lot of you wrote about this when we talked about the oncoviruses. There's over 200 known subtypes, guys. 40 subtypes are sexually transmitted. This is the most common STI in the world. Pretty crazy to think about that. For your test, I'd like you guys to know this. Type 6 and 11 are best known for causing genital warts. Again, 6 and 11, genital warts. Type 16 and 17 are cancer causing. Again, 16 and 17 are cancer causing. Another fact you should know, HPV causes about 90% of cervical cancers. That's pretty humbling when you think about it. HPV causes 90% of cervical cancers. This is something that's preventable, okay? It's preventable. And another thing I'd like you guys to be aware of, men can also get cancer as a result of an HPV infection. In fact, there are men that have had penile cancer as a result of HPV. So this, again, is something that we need to think about. Safe sex is important. If you don't get the infection, look at how only 10% of cervical cancers, guys, are caused by something other than the virus. So you'd really be protecting yourself. Now, I just wanted to point your attention here, and you guys have these PowerPoints at home, but I want you to look at the difference between healthy cervical cells and cancerous ones. You see how flat, nice and even they are over here? Look at how bunched up these are. The nuclei are bigger. Everything looks different. This is what they're looking for in a pap smear, is that type of cell clustering. Now, there's different types of vaginal infections that can occur out there, and two of those are called vaginosis and vaginitis. Big thing to know about vaginosis. Symptoms may include foul-smelling vaginal secretions and or excessive secretions. Okay? Now, the biggest difference between vaginosis and vaginitis is that vaginitis, you will have vaginal inflammation. Again, vaginitis, vaginal inflammation. So please know those terms for your exam. Chlamydia, guys, I talked about it earlier, but it does cause a lot of different types of STIs worldwide. And 39% of cases are in people 20 to 24. Gonorrhea is caused by Neisseria gonorrhoeae, which is gram-negative, and it's diplococci, so please know that. Gonorrhea, caused by Neisseria gonorrhoeae, gram-negative, and it's a diplococci, guys. Again, highest age group is people who are 20 to 24. So that makes sense because that's when people are dating and that kind of thing. By the time you get in your 30s and 40s, etc., you're normally, not always, in a monogamous type of a relationship. For syphilis, please know it's caused by Treponema pallidum. Again, syphilis caused by Treponema pallidum. 54% of those cases are in men who have sex with men only. And you can see the distribution based on sex, like having same sex or heterosexual sexual activity, etc. in that case. So I'm going to go through a couple phases that I want you to know for syphilis. First off, the infection starts with contact with an infected person's chancre sores. Okay, so it starts with chancre sores. So, in the primary stage, the chancre will appear at the initial site of the infection. And right here you can see this is what a chancre looks like. So again, for your test, primary stage, chancre appears at the initial infection site. In the secondary stage, usually involves a rash. Bacteria enters a latent period that lasts for months to years. So it's crazy, guys. The chancre goes away, and all of a sudden you get a rash about 3 months later or so. Note for the last phase, which is called tertiary, causes lesions on the skin and bone, heart damage, and neurological symptoms, and you will see the presence of gummas. Now, some people don't express these gummas for years and years after the secondary phase actually goes away. But again, if it gets to that point, sadly, most of the people are going to die of some kind of neurological type of problem, hallucinations, and things like that can occur. And here's secondary. And what's weird, guys, that's the palm of somebody's hands. We don't see many rashes on the palms. And this is an example of a lesion that happens to be on this person's face as a result of syphilis infection. Again, chancre is an ulcer-like lesion that is often on the genitalia but could develop elsewhere, mainly associated with syphilis. Now, there's a couple of different types of vaginal infections out there, guys. Please know the main infection, yeast infection in women, is caused by Candida albicans. It's dimorphic, and it's an opportunistic pathogen. Again, Candida albicans, dimorphic, opportunistic pathogen. So please take a screenshot of this slide here. And basically what this slide is showing, guys, is that when you have an asymptomatic situation, the yeast just kind of hangs out on the top here. But if things change, like the vaginal pH, an increase in estrogen, what the yeast looks like changes. It's dimorphic, so it starts to look not only yeast-like, but mold-like as well. And that's what you'll actually see in a vaginal swab. And trichomoniasis, please know, is a motile flagellated protist with undulating membrane. So this microbe that can cause vaginal infections is a protist, flagellated and undulating. About 3.7 million cases in the United States.